I think I'll start ahead of time before all of our doctors get here. They're in the house, they're just not seated, but I want to stay on schedule as much as possible. I used to have my opening statement here. Again, good morning. The U.S. recorded its first laboratory-confirmed case of COVID on January 20th, 2020, 2 years and 4 days ago. We have endured 2 years of the pandemic, and COVID-related deaths have surpassed 5.6 million globally and 889,000 in the U.S. The U.S. ranks 22nd in deaths per million at 2,575. Sweden, if you all recall, Sweden early in the pandemic was excoriated by the world press. Sweden ranks 63rd with 1,514 deaths per million. Again, the U.S. were 22nd at 2,575. Sweden is 63rd at 1,514. The human toll resulting from economic shutdowns is incalculable. The erosion of freedom and growing divisions within society, exacerbated by vaccine mandates, should concern us all. The latest variant, Omicron, is sweeping the planet as a weary public prays for it to be the last. The purpose of today's forum is to discuss the global pandemic response, the current state of knowledge regarding early and hospital treatment, vaccine efficacy and safety, what we did right, what went wrong, what should be done now, and what needs to be addressed long term. There's still much to learn about the coronavirus, COVID the disease, and COVID vaccines. Early in the pandemic, our knowledge was minimal. But even then, because of what we learned from Italy and the Princess cruise ship, it was becoming obvious COVID was a disease that targeted the old and those with certain comorbidities. Instead of using that information, public health officials pursued a one-size-fits-all response that relied heavily on creating a state of fear to ensure compliance. They also kept moving the goalposts. For example, we went from a 2-week shutdown to flatten the curve to zero COVID. From masks weren't necessary to a single mask wasn't adequate. From a vaccine that would prevent infection to a vaccine that reduced severity of the disease. And as goalposts were moving, different viewpoints were being crushed. At the very moment when outside-the-box thinking was required, the internet could have been used by practicing physicians to share their experiences as they developed effective therapies. The internet was used instead to censor discussion and vilify anyone with a different opinion. Until COVID, a fundamental principle of medicine was early detection, allowed for early treatment, which produced better results. 2 years into the pandemic, the compassionless guideline from the NIH, if you test positive, is to essentially do nothing. Go home, isolate yourself in fear, and pray you don't require hospitalization. It has also been sound medical advice when dealing with a serious illness to get a second opinion, maybe even a third. Today is about getting that long overdue second opinion. So just a couple housekeeping items here. First of all, I want to thank everybody for coming to the event here in person. I want to thank the news outlets that are live streaming this, OAN, Rumble. But in particular, I want to thank the courageous doctors that have shown the compassion to actually treat patients, to struggle to provide the information that is being kept from the American public, and suffer the vilification, the censorship, the suppression, the termination, the lawsuits that has come with their courage. Now, one thing I hope everybody realizes how highly qualified this panel is. I intended, quite honestly, for this event to hold no more than a half a dozen, but it was pretty hard to turn down the offers of eminently qualified individuals coming here to share their information, their opinion with the American public. So just so you understand how I met these individuals, very early on in the pandemic, I was witnessing videos being posted by other courageous doctors that were thinking outside the box and coming up with a different theory of what this disease really was. They started posting their videos, and those videos started being taken down. And somehow, I really don't know how, I got involved in, connected to a group of global doctors and medical researchers on a number of different email sites. And I rarely chimed in, but I was just listening to the flourishing of information, the sharing of different studies, completely different from what I was hearing in the mainstream media. I'm not quite sure how all these experts came together. I'm hoping to ask them if they can kind of tell us exactly how that happened. But again, I just want to thank them for being doctors, for being medical research, for being medical researchers, for being academicians that have had the courage to withstand all the criticism. Now, I do want to point out that we invited folks from the other side of the narrative, federal health agencies, their heads, or some representative from them, the CEOs or some representative from the vaccine manufacturers. They decided not to show up, which I think is somewhat telling, but also very disappointing. Now, I do have, I want to report that one individual I invited was Dr. John Raymond from the Medical College of Wisconsin. And Dr. Raymond, again, this was short notice. I don't blame him for not being able to disrupt his schedule and be able to travel here right away. But he was at least courteous enough to send me a letter, which I will enter into my own personal record on our website. I just want to read two of the 10 points that he made. His second point is, what we need to do is to holistically evaluate our strengths and gaps in medicine, science, society, and policy with humility, integrity, and curiosity, so that our next public health response is efficient, is seamless, and inextricably integrates decisions about human health, our economy, the needs of our communities, and the future of our children. His third point is for each of us, none excluded, to openly, honestly, and with respect and compassion explore how, where, and why the roots of division are springing up within our nation, our communities, and our institutions. I don't think there's an American that can disagree with what Dr. Raymond wrote. And I also have to say this is exactly what we are attempting to do here today. So again, I want to thank Dr. Raymond. Sorry he couldn't come here today. What I'm hoping is that we can assemble, probably not as large a panel because a lot of these folks are in here for the anti-mandate rally, but maybe a few of you would come to Wisconsin and sit down and actually have a discussion, an open dialogue, an honest dialogue, because I think that'd be very important for not only the folks in Wisconsin, but for the American public. Now, the way this event is going to unfold is I've asked each of the presenters to provide an opening statement. I was quite adamant about keeping it to 400 words, so this should move pretty quickly. Following that, we'll have an open, pretty free-flowing discussion. I've got a bunch of questions. They will question each other. We'll have opportunity for the press to ask questions. We'll have some opportunity for some members of the audience also to step forward because other people, we have the opportunity to have them here. We also have the opportunity for the viewing audience to ask questions through our Rumble webpage. Now, for the audience, I do want, and I'm telling everybody, keep your answers, keep your statements succinct. There's a lot of ground to cover here. And Dr. McCullough will be my co-moderator here, and we'll try and keep this going as quickly as possible.